Hi, I'm Lisa Vasquez, Substance Misuse Prevention Coordinator for the City of Nashua Division of Public Health and Community Services. And we're going to talk about substance use disorder and language today.
And my name's Jessica Parnell, and I'm the Program Director at Revive Recovery Center. After Lisa talks about language and substance use disorder, I will then do a Narcan training.
Substance use disorder is a medical condition caused by repeated use of a substance or multiple substances. And in the past, you might have heard words like addiction, substance abuse, substance dependence, but the new Diagnostic and Statistical Manual, the DSM-5, has changed the diagnosis to substance use disorder. So that is the term that we will be using from this moment going forward. Substance use disorder is classified as a clinically significant impairment in health, social function, and impaired control over substance use, and are diagnosed through assessing cognitive, behavioral, and psychological symptoms. Some people might think, well, maybe some people can just stop, but it's not just about the substance use, it's about the psychological and cognitive symptoms that are accompanied with the diagnosis. This is the brain, and on the bottom you would have the spinal cord. And the spinal cord's job is to send messages from the body to the brain. If you think about maybe dropping something on your foot and breaking your foot, your brain wouldn't know that you would that you are experiencing pain unless a message is sent from your foot that travels through your spinal cord to your brain to let you know that you are having pain. One of the things that substances do, specifically opiates, which is why they're prescribed when people have major incidents, is that they block the message from getting to your brain. So if you had surgery or you broke your foot and you're given an opiate, it doesn't mean that your foot is not broken, it doesn't mean that you're not in pain, it just means that the message of pain isn't getting to your brain. After that, you have the brainstem, and the brainstem is in charge of controlling things that you wouldn't normally think about, like breathing. Breathing isn't something that you have to think about. The brainstem takes care of that so that you can focus your brain power on other things. Then comes the limbic system. The limbic system controls emotions, and it's where substances kind of dump a big amount of dopamine so that you feel pleasure. And then after that comes the prefrontal cortex. And the prefrontal cortex is in charge of rational thought. Things like thinking about if this, then this. So if I do this, so if I drive and I speed, I might get pulled over. That's a rational thought. What happens with substances is that they turn off the brain from the front to back. So the first thing to go is that prefrontal cortex, that rational thought. And you can see that if you see someone who's been drinking for a while, you'll notice that at first they'll start doing things that they normally wouldn't do or say things that they wouldn't normally say. Because their prefrontal cortex, which I like to think of as like a catcher's mitt that catches impulses and stops to decide, hey, is this a good idea or a bad idea, isn't really working. So again, the brain shuts off from front to back. So if a person uses a substance and it turns off their prefrontal cortex and they continue to use until the brainstem is affected, that is when someone has an overdose or even alcohol poisoning, which is pretty much an overdose with alcohol. What happens is that the brainstem gets overwhelmed with that substance and it doesn't allow the brain to do its function, that part of the brain to do its function, which is having people have the ability to breathe. With repeated use, one of the things that happens is that our brains need balance. So they're always doing what I call a systems check. You can think about it as like when you turn on your car does a system check and lets you know, hey, is my tire pressure right? Do I need gas? Things like that. Well, your brain does a system check all the time to make sure that there's balance and equilibrium in your brain. So if there's too much dopamine in your brain will decide, I have too much dopamine, I need to lower the amount of natural dopamine in my brain. which means that the next time someone uses a substance, their baseline for dopamine will be lower, and they'll need more of a substance to get the same high that they got the first time. And after repeating that process multiple times, the amount of natural dopamine can be 0 or stopped being produced altogether. If someone continues to use and then for a long period of time and stops abruptly, they'll experience what we call with symptoms of withdrawal or withdrawal symptoms. So what happens is that your body no longer has dopamine, and your body is physically dependent on this amount of dopamine and this substance. So you'll feel cravings, but not just craving and wanting more of that dopamine and more of that feeling, but your body will also react by having tension, panic attacks, tremors, difficulty concentrating, anxiety, irritability, disturbed sleep. And when I say disturbed sleep, what I mean is some people can sleep for like 3 days straight or not be able to sleep for 3 days straight. They can have headaches, heart palpitations, sweating, nausea, and the list can go on and on depending on the substance. And if we're talking about alcohol or benzodiazepines, it can include convulsions, which can lead to possible death. So just to summarize, people start using because it feels good when they use a substance. And it doesn't matter why they started to use. So some people might start to use because they have a mental illness and they're self-medicating. Some people might have experienced trauma and this is their way of kind of numbing that pain. Some people might feel lonely and this is the only way to connect to other people. It doesn't matter. The substance doesn't really discriminate why you started using. This process happens in the brain, where the body gets used to the amount of dopamine in the brain and craves that substance and needs that substance to maintain that equilibrium in the brain. So if you stop using abruptly, you get those withdrawal symptoms. You develop an emotional connection to that substance because now every pleasurable experience is connected to that substance. And you have an impairment in your brain because that prefrontal cortex, that rational thought part of your brain that tells you, hey, this is not a good idea. If I keep doing this, I will get negative effects. It's not working. And you have all that excess chemicals in your brain. So all of that is happening at the same time. And all while this is happening, most people that are in early recovery or experiencing those withdrawal symptoms, experiencing all those negative effects, know that all they need to do to feel better is have that substance again, even though in the long run it would be best for them to stay in recovery. So language. The words that we use are really important. If you think about that phrase, sticks and stones may break my bones, but words will never hurt me, that's not real, right? Words do hurt. And when we think about this stigmatizing language, what it does is it creates biases in people. It creates ideas that are not true. So when we think about words like addict, junkie, it makes it seem like people have a choice whether they stop or continue to use a substance. But as you saw in the previous slide, your brain kind of works against you when you're using a substance and hijacks your brain into thinking that you need that dopamine, you need to continue to use to feel normal. So what words am I talking about? I'm talking about words like junkie, alcoholic. We need to stop using these words and use instead person with a substance use disorder. Substance use disorder, like I said, is the diagnosis, and we should use person-first language in everything we do. We shouldn't call people diabetics or schizophrenic. We should always say person with diabetes, person with schizophrenia, because people are people and have value just by who they are, and they're not defined by their illness. And instead of addiction, use substance use disorder because, like I said, the diagnosis has been changed. So that is the actual diagnosis that is on the diagnostic and statistical manual. Instead of words like clean or dirty, instead use abstinent or actively using, because people aren't dirty because they use a substance. They're just having a substance use disorder. And instead of former addict, person in recovery, because when you say former addict, no one hears the word former, they just hear the word addict. And instead of relapse, use resurgence or reoccurrence, because that's what you would use for any other disorder. Instead of dirty, actively using, and we're not going to use words like crazy or suicidal. We're just going to use experiencing a mental health crisis or having thoughts of self-harm or suicide, because both of those things are very treatable, and we want people to know that there's help out there, and that they only need to call and someone will reach out. So emphasize that substance use disorder is a medical condition that is treatable and preventable. Frame the conversation as a health issue, because that's what it is. If we think about all the years that funding was cut to treatment for mental health or substance use disorder, you can go back to the language that was used. It's really hard to advocate for junkies and addicts to have funding for treatment, but it's not when you say someone with a substance use disorder needs treatment. So that's why language is so important. Use person-first language in everything you do. Use examples of people who have reached long-term recovery. There are about 25 million people in the U.S. living in long-term recovery, and we should talk about that more, because that's a lot more people than the ones that are actively using. Discuss the fact that people can and do change, and share hope.